Hello, my friends, and welcome back. Thank you very much for being with me again today. My cousin here, this is a second video for tonight, and we're going to keep on going. This video's subject would be healthcare. A right, not a right, public healthcare, private healthcare, and some contrast and comparison between, I would say, the communist system that we lived under in Romania and American healthcare system that I lived through here, and the Canadian healthcare system that my cousin has to live through. I will start with a general piece of information. In Romania, under the communist system, the socialist with the communist party, because it was not a communist system over there, it was a socialist system with one party system. We got two here, we're a little bit better. So, over there, regardless if you were employed, regardless if you were not employed, you had healthcare. If you went to a doctor, you went to a clinic, you would be tended no money. You would pay no money, no fees. Well, you could bribe. That was a bad thing. But nevertheless, the dentist, the same thing. No, nobody would pay. It was paid, taken out of your taxes before you were getting your money. And everyone was working because it was mandatory. You could not be unemployed. Now people say, well, it was a bad healthcare. Well, his mother was a doctor, medical doctor. My mother was a pharmacist. So we are very much, how should I put it? We know about the system very much, not only by direct experience, but also because our parents, half of them, were involved in the medical system. So, if you want to talk about the Romanian communist system, if you want to talk about the Canadian, feel free to.
Healthcare is important for all of us, and the point is, how do you analyze it? How you decide if a certain system is doing good for you? Because there are many parameters. One of them being cost, another them being how quick you will be treated, another will be how well you will be treated, and usually the conversation tends to be I'm looking, for example, in Canadian system, who is a public system, they would try to emphasize the things in which a public system is good.
You mean government?
Yeah,
organized.
Yeah, government organized, and they would just put under the rug all the things that are bad. And the question is, for example, if you have an experience, a personal experience, are you treated well or not? And I can give you one very interesting, I think, example in which I suffered from a certain health issue in United States, being in a visit.
I had that little medical accident.
Yes, and a very short situation. I stayed 1 day in hospital, $23,000, and I was suggested $23,000.
Wow.
Yes, and I was suggested that my situation is so bad that I would have to have a surgery that would cost around $100,000. I was so scared that eventually I requested somehow a certain way of living back in Canada. So they practically put me sign a certain paper in which I said, okay, I assume all the responsibility.
On your own risk,
on the risk that I'm going to take,
and,
yes. And then I also kindly asked them to give me a certain referral, because I know that in Canada the problem is, are they going to accept you in the hospital or not? So they gave me the referral. So I fly in Canada, and I'm going with the very same situation in the basically 24 hours. And in Canada, they take me, they run the same test, and they say you don't have to stay even in hospital. Your condition, it doesn't require anything. So, and I said, in United States, it was suggested a surgery, whatever. No, no, okay. So basically, I came back at home at 3 o'clock in the morning because they couldn't even give me a bed. Now,
Based on their
their
tests.
assessment, their test. So there was the same test, pretty much the same medical science, that but two different economic interests. One of them in the public system go away. One of them, and this happened to me, and it's concerning that something like this can happen, and people don't even know what to do.
As far as I know, physiology and anatomy did not change. So when this is one of the stories that I heard here in the United States of America, I'm not bashing. I'm just sharing with you, my guys, my friends. They tell us that the medical doctors are not recognized, that their credentials are not recognized here, and I don't understand why. Because they study the same shit these guys are studying. What are they missing? So you have to go through the same process as a dentist or a regular, I don't know, generalist doctor. You have to go to the same, you have to start over, which basically the illnesses are the same, the symptoms are the same, the medication is the same, the chemicals are the same. No, I mean, unless you go, even the surgeries are the same. You might use different machines or whatever to advance, but the thing is this thing. You're still gonna cut the skin, you're still gonna put this, it's the same thing. It's just, now, is it a human right to have it or not? Let me just start, because we might differ on this one. I got a gut feeling on this one. My problem is who's paying. I do not like to pay for someone else's service, if I'm not asked a little bit about it. That's my point. Now, in a civilized industrial country, I think everyone should have it. But do not abuse it. You say, that's easy. How can you abuse it? Well, it's very easy. It's very easy. You can monitor. And on the other hand, you can just, don't have a job and go to have, I don't know, a boobs implant or something like that. I mean, it's an emergency, it's an emergency. But on the other hand, all that can be monitored. It's unacceptable, I think, in a country that considers it, I'm talking about the United States of America, that considers it the wealthiest, the greatest, not providing working people with medical, or people that are in dire straits. Sometimes they lose their job. You're done. I disagree with that totally. Now, in countries that cannot afford, for whatever reason, but the problem is, even the Romanian communists were able to do it, and they didn't go bankrupt because of that. That story is for children, okay? And they were able to do it, and these guys are not able to do it. What's your take on this?
So, for sure, there are costs involved, but I think that prior to analyze, especially if it's a right or not, is who is going to provide it. Meaning, there are some people that are sick, but then there are nurses, doctors, many people that would have to work for this, for the other part, the people that are sick. So now, are we treating these ones, the nurses, are we paying them enough? Are we giving to the doctor enough? Because if not, what we are going to do is some politicians are going to just say it's a right, but they are going to basically put two categories of people, one against each other. They are going to divide the providers. Yes. And in this way, in the name, it's a very nice, the same with education. Education should be for everybody. But if you look a little bit deeper, some people are providing, some people are receiving. And if you start to look like this, the question is, let's pay the nurse $300,000. And we still say that it's a right. Then the population that pays is going to say, it's too much. So what is enough? And what is enough? if you are into an emergency,
the invisible hand.
the nurse that has to work in a very difficult condition, or a doctor that every day sees 300 patients, but it's a right for these patients. And I don't see in an honest way that this can be a right, because you put some people against other people's interest, and it shouldn't work this way. It's the same with education. A better organized community would have better schools. A worse organized community would have worse schools. It's not you are not just going to flatten everything, and eventually you are going to end up just you establish. Right now there are all these big institutions, like they are become bigger and bigger, all these hospital, because they cannot solve the problem, and there will be going to be more and more and more money absorbed, and nobody is happy. Not the doctors, not the administration, not the nurses, not the patients, because the concept is wrong. There is no right. There is no right, in my opinion. It's you gain it in you something that you gain in a certain way.
Then is the question, if it's not a right, and probably people would ask, what happens with the people who have no insurance? Do they die? Would you let them die? That's the question. How are you going to solve that one? Because people say, yeah, okay, it's not a right. That means, let's say I work as a laborer, and let's say I work, my wife doesn't work, and my business, my company gives me, let's say I have health insurance, but not my wife, or maybe doesn't even give me, let's put it this way, and it's not a right, and something happens to me, and I have a surgery, $100,000. Am I dead for the rest of my life? So what do you do with these people who, if it's not a right, how do you solve the people who don't have health insurance? What would be the
like there are spin doctors, right? I'm going to give you a solution, but it's not tested. When everything bubbles, that's why, because everything bubbles right now, it's 100,000 the surgery, because everything is kind of centralized. All the things are super big. Even the the private sector goes through insurance, which means huge piles of money, in which how much money goes to the provider and how much money is just funneled to various interest administrations. So the prices, the invisible hand, the real capitalist idea of competition would solve it, and I don't think it would be 100,000. There would be doctors that would do the work, and they would be qualified, but if everything is centralized, the costs skyrocket.
So let me see if I got it right. You think that people who don't have insurance provided by their employer, they should pay from their own pocket?
Yeah.
And if they don't have it?
If they don't have it,
they don't have the money.
If you don't have what to eat, you go into a certain food bank. If you don't have right, but so there would be, it wouldn't be a right. Like if you go like this on the street, there would be a certain location here where eventually you would be treated. But honestly, it would be a little bit, it wouldn't be the same shiny thing, the same, like some people have nicer car, or some people have older cars. It's not like everybody has the right, and then you skyrocket everything. So it has to be according to the budget somehow, and there would be programs of the government that would maybe take care of very specific situations in which they intervene, and they have a number of very specific institutions. But it's not like right now it's bubbling. Everything is big, and when they say that they destroyed Obamacare or whatever, everything is a bubble in private and in public. And because too much money are put in one place, and then they don't even get to the providers. And the whole point of is the right, it's for the politicians, because they deliver to you something, which by the way they don't deliver, because the doctors, the nurses deliver, and it's their life in there, and whoever has somebody from the family, they feel for the nurse or for the doctor, the same like for the sick person. They have rights.
Well, as I said, I think it's the remuneration, the way that nurses, the doctors are paid. That could be fixed, but I think that in a if you call yourselves a first world country and so rich, I still think that you could find a way that people don't have money. People don't have money. They don't have money to buy cigarettes, which they shouldn't. But anyway, it's their choice. Whereas it's unacceptable to go and buy some pills for whatever, $500 for, I don't know, 20 days or 15 days. You don't have the money. Just think about your case. A lot of things are inflated. The problem is this: how is it possible to buy the same medication in Romania with the same chemical? That's a different name, Gugu name, but the same chemical, because you don't buy the name, you buy the chemical in the pill. You buy that at the $1, the medication, and here you buy it for hundreds of dollars. That's another thing that is very strange. I personally did not have a good experience with the medical system here. Not with the organization, which I think it's over organized in such a way. I think the waiting from one room to another and so on, it's annoying as hell. That's one thing, but it's okay. I guess at least you get it, the service. My services I have provided by medical personnel in this country, which is United States of America, I have to tell you direct experience. Let's say from 10, 9 were bad. 9, I gave answers to the doctor what they should do. And I would give you 3 examples. One was my right ankle from playing soccer. I just, turn it. The other one, my left ankle. Another example, I went with one of my kids at the emergency room, and the doctor spoke with me like I was the patient. The doctor did not even bother to see who was the patient. My child was, I think, 21 or 19 months old, and the guy thought that it was me being 19 years old or something. So he was talking to me and was like, what the hell? You're a medic. I mean, you make mistakes, you're tired, I understand that. And with the ankles, they didn't even touch me. They did not touch me. They didn't come close 3 feet to my ankle. Both of them. And they say, put ice and immobilize it. And I asked them, because pharmacist, doctor, I said, should I use some ibuprofen, which has an anti-inflammatory, how do you call it, a property, which, sucks the whole inflammation over there. He said, oh, yeah, you can use it. Fuck you. I mean, how much money you make? I tell you if I can take ibuprofen. He told me ice on 2 occasions, 2 different doctors. So that's why I have to be straight with you. When I'm going to a doctor, I'm looking for this. And I'm stereotyping, but I have to tell you. I'm looking for an Indian doctor. I'm from India. I'm looking for a Chinese doctor or an immigrant somehow, but being about 60 years old and up. Preferably, I'm not going to say more. All right? That's what I'm looking for. When I see a young, full-blooded American, I am a little bit skeptical that by direct experience, I know that it's not stereotyping, it's direct experience with people, for whatever reason. And I had a lot of experience with doctor, not only direct experience, through my job through my job. I had experience with medics, with children, and pediatrics and surgeries, and I was like, no, I'm not saying all of them are like that, but I personally had this bad experience. And you pay a lot of money for health insurance, and I don't think it's the best in the world. They treat you very nicely, but I don't want to be funded and so on. I want the service. I want the person to know what the hell he or she is talking about. Something before we close?
I believe that what is important is to see that in any way, whenever somebody talks about a right, it's talking about a certain way of redistribution. Because let's say if I'm saying right now that everybody has the right to have their house painted in a certain color in the next year, there will be some kind of redistribution. There will be taken some resources from there to there. So when you take Healthcare, there is going to be a redistribution. Now the question is, if everything balloons, you will talk nice words, but you will not be able to keep it up. And eventually, especially with the because we are living longer, we are as you grow old, there are going to be more and more people who are sick. The system will implode. So with all this right thinking, it will not be practical.
Maybe it's the right that you have a right for this. I don't think that's the right word. And that the word redistribution is very wrong, because redistribution means that something was already distributed. I don't remember anybody distributing money to the wealthy. So it's no redistribution, it's distribution, it's taking, it's Robin Hood. So I don't like when say we want a redistribution. It wasn't a distribution in the first place. So that's what it is. And I'm pretty sure that you guys had your own experiences with the medical system and all that. And good luck. What else can I tell you?
Don't be sick. Stay healthy.
Yeah, thank you very much for being with us today. Stay strong, stay smart, look for the truth, and be just.